What is COVID-19 disease? COVID-19 is an infectious disease caused by the last detected virus from the coronavirus strain. There was no knowledge of the existence of this new virus and its disease before it began to spread in the city of Wuhan, Chinese in December 2019. COVID-19 has now become a pandemic affecting many countries around the world. What do I do if I have COVID-19 symptoms, and when should I seek medical attention? If your symptoms are mild, such as minor cough or mild fever, there is generally no need to seek medical attention. Stay home, isolate yourself and watch your symptoms and follow the instructions national about self-insulation. But if you live in an area where malaria or dengue is prevalent, it's important not to ignore the symptoms of fever. Ask for medical help, and when head to the healthcare facility, put a muzzle if possible. Keep at least 1 meter between you and others, and avoid touching the surfaces around your hands. And if the patient is a child, help him stick to these tips. How does COVID-19 spread? People can catch COVID-19 infection from other people infected with the virus. The disease is mainly spread from person to person by small villages that it is excreted by a person with COVID-19 from his nose or mouth when he coughs, sneezes, or speaks. These droplets weigh relatively heavy. They do not move far away but fall quickly on the earth. People can catch COVID-19 if they breathe these cats from a person infected with the virus, so it's important to maintain a distance of at least 1 meter, 3 feet, from the others. These droplets may land on objects and surfaces surrounding the person, such as tables, door handles, and stair rails, and then people can get infected when they touch these objects or surfaces and then touch their eyes, nose, or mouth. Therefore, it is important to wash your hands with soap and water, or clean them with an alcohol disinfectant to rub hands. How can we protect others and ourselves from infection if we don't know who has it? Being clean, edited, and respiratory is important at all times, and is the best way to protect yourself and others. Keep at least 1 meter, 3 feet, between you and others when possible. It is a particularly important issue if you are standing next to someone coughing or sneezing, and since some people infected may not show symptoms yet or have only mild symptoms, keeping a distance away from everyone is a good idea if you are in an area it is in the case of COVID-19. Can COVID-19 infection be picked up by someone who doesn't have symptoms? COVID-19 infection is mainly spread by respiratory droplets produced by a person who coughs or has other symptoms such as fever or fatigue. But many of the injured people, they have only very mild symptoms. This is particularly true in the early stages of the disease. Infection can already be picked up from a person suffering from a cough late and doesn't feel sick. What do I do if I have been closely contacted by someone with COVID-19? If you have had close contact with someone with COVID-19, the infection may have also spread to you. Nearby contact means that you live with or with someone who has the disease at the same location, less than 1 meter, 3 feet. But if you live in an area where malaria or dengue is prevalent, it's important not to ignore the symptoms of fever. Ask for medical help, and when you go to the care facility, apply a muzzle. If possible, keep at least 1 meter between you and others, and avoid touching the surfaces around your hands. If the patient is a child, help him commit with these tips. If you don't live in an area where malaria or dengue is prevalent, please follow the following tips. If you feel unwell, even with very mild symptoms such as mild fever or aches, you should isolate yourself by staying at home. Even if you think you haven't had COVID-19 infection, but you've had these symptoms, isolate yourself and monitor your symptoms. The risk of transmission in the early stages of the disease increases when the symptoms are mild, so it's very important to isolate yourself early. If you don't show any symptoms, but you've had an infected person, stay quarantined for 14 days. If you are confirmed by laboratory test that you have COVID-19 infection, you should isolate yourself for 14 days even after symptoms have disappeared. As a precaution, it's not even known for the exact part now how long a person remains contagious after recovering from the disease. Follow national guidelines on self-isolation. What does self-isolation mean? Self-isolation is an important procedure for people with symptoms to avoid transmission of infection to others in the community, including family members. Self-isolation is when a person with fever, cough or other symptoms of COVID-19 has to go home and refrain from going to work, school, or places public. Such isolation can occur voluntarily or on the basis of a recommendation from a healthcare provider. But if you live in an area where malaria or dengue is prevalent, it is important not to ignore the symptoms of fever. Ask for medical help. When you go to the healthcare facility, put a muzzle, if possible, and keep at least 1 meter between you among others, and avoid touching the surfaces around your hands. If you are a child, help them. Stick to these tips. If you don't live in an area where malaria or dengue is prevalent, please follow the following tips. If a person is in self-isolation, the reason is that he or she feels unwell without being severely ill, does not require medical attention, choose for insulation a separate, spacious, airy room with toilet and hand cleaning supplies. If there is no separate room, stay away from the sleeping beds at least 1 meter away. Keep at least 1 meter away from others, including family members. Monitor your symptoms on a daily basis. Isolate yourself for 14 days even if you feel healthy. If you have symptoms of difficulty breathing, consult your doctor immediately. And, if possible, call your doctor first. Stay positive and dynamic by staying in touch with your loved ones by phone or online, or doing some exercise at home. What is the difference between self-isolation, self-quarantine, and physical spacing? Quarantine means restricting activities and isolating people who are not sick themselves but may have been infected with COVID-19. The goal is to prevent the spread of the disease while there are almost no symptoms on a person. Isolation means isolating sick people who have symptoms of COVID-19 and can transmit infections to prevent the spread of the disease. Physical distance means physical licing away from others. You must stay away from others at least 1 meter, 3 feet, away. It is a general recommendation that everyone should apply even if they were in good health and were not infected with COVID-19. Can children and adolescents develop COVID-19? Research indicates that children and adolescents are no different from other age groups. Evidence available to date suggests that children and young people are less likely to develop severe complications of the disease, but this is still possible among this age group. Children and adolescents should follow the same guidelines on self-quarantine and self-isolation if they are at risk of infection or develop symptoms. It is important in a way, especially if children avoid contact with the elderly and others who are more likely to develop severe complications of the disease.